In terms of arterial supply, again, as in the upper limb, the collateral circulation is pretty good, and so there's not a whole lot for us to be paying attention to in terms of clinical importance. Just a few issues to point out to you. We've already said that when the external iliac artery crosses under the inguinal ligament to enter the thigh, it changes its name to the femoral artery. And when it does so, it's entering this region of the thigh called the femoral triangle. So when the femoral artery and femoral vein and femoral nerve pass under the femoral ligament, they enter this region known as the femoral triangle. Now, the femoral nerve is simply going to then distribute to all of the muscles of the anterior thigh. So that's, the femoral nerve doesn't go much further than that region. The femoral artery and vein, however, continue on going right through the femoral triangle, and then will pass into the posterior side of the thigh by going through an opening in the tendon of the adductor magnus known as the adductor hiatus. And that brings the artery to the posterior side of the thigh. Once it has done that, it changes its name, and it's now called the popliteal artery. So here we see it on the posterior side. It's now called the popliteal artery. It's simply the inferior continuation of the femoral artery. And of course, the same is going to be true for the vein. Femoral artery and vein become popliteal artery and vein. But take note of the fact that even though the femoral artery eventually gets to the posterior side of the thigh, that artery does not provide blood supply to the posterior thigh. It's simply passing through the posterior thigh. The femoral artery provides blood supply to the anterior thigh from branches that emerge from in the region of the femoral triangle. The artery that will take care of the posterior thigh is a branch of the femoral artery called the deep femoral artery. So the deep femoral artery, a branch of the femoral artery, leaves the femoral artery and then sends branches that perforate through the adductor magnus and go to the posterior thigh. So the deep femoral is responsible for the posterior thigh. The femoral artery itself is responsible for the anterior thigh. After the femoral artery crosses into the popliteal region, changes its name to popliteal artery, as it then crosses the knee, it divides into two branches, an anterior tibial artery and a posterior tibial artery. The posterior tibial artery remains in the posterior compartment, so it supplies the posterior compartment along with a branch that it has called the fibular artery. So the posterior thigh gets its blood supply from the posterior tibial and the fibular artery. The anterior thigh gets its blood supply from this anterior tibial artery, which, although it initially is in the posterior compartment, then passes just above the interosseous membrane to get back into the anterior compartment, and then continues down through the anterior thigh, supplying the muscles of the anterior compartment. It's that artery, the anterior tibial artery, that is subject to being compressed in what's known as anterior compartment syndrome. Because the muscles that occupy the anterior compartment are very tightly bound in place by the surrounding deep fascia, when you get swelling in that anterior compartment, because there's very little space available for the swelling to occur, you can end up compressing the anterior tibial artery and thereby compromise the blood supply to the anterior compartment. So it's compression of the anterior tibial artery by the anterior compartment muscles that results in what's known as anterior compartment syndrome. The anterior tibial artery continues on into the dorsum of the foot, and when it reaches the dorsum of the foot, it changes its name to the dorsalis pedis artery. The thing that's significant about the dorsalis pedis artery is that it's an easily palpable pulse on the dorsum of the foot. And since that pulse is the most distal palpable pulse in the lower limb, it's an important pulse to use to quickly ascertain the quality of arterial supply to the lower limb. In other words, if there is a good, strong dorsalis pedis pulse, that probably indicates that the integrity of the vascular tree throughout the limb is probably pretty good. The artery that crosses onto the plantar surface of the foot is the posterior tibial artery, And when it does that, it crosses behind the medial malleolus. So there's a pulse that's palpable behind the medial malleolus, and that's the posterior tibial pulse. So the anterior tibial artery can be evaluated by palpating the dorsalis pedis pulse on the dorsum of the foot. The posterior tibial artery can be evaluated by palpating itself at the behind the medial malleolus. More proximally, the popliteal artery has a pulse that can be palpated. It's deeply placed within the popliteal fossa. It's not always the easiest pulse to palpate because it's so deeply placed in the popliteal fossa. And then most proximally, the femoral artery has a pulse that's palpable immediately below the midpoint of the inguinal ligament. As it enters the femoral triangle, right under the midpoint of the inguinal ligament is where you would palpate the femoral pulse. Again, just as in the upper limb, in the regions of the joints, there's very good collateral circulation. So around the hip joint, we have vessels, collateral supply. Around the knee joint, we have collateral supply. And around the ankle joint, we have collateral supply. So as was the case in the upper limb, compromise to the blood supply in the lower limb is not very common because of the good collateralization. The most common way for compromising the blood supply for the lower limb is actually before the artery even gets into the lower limb as the external iliac artery or even the common iliac artery. This is not an uncommon site for atherosclerotic deposition, and that would compromise the blood supply to the lower limb before all of those collaterals have had a chance to come off. And that's what is often presents as what's known as intermittent claudication, where the patient, upon exercise and increasing demand for oxygen to the muscles of the lower limb, starts to develop pain in the lower limb as the patient continues to walk or exercise the lower limb. So that's all we need to say about the arterial supply to the lower limb.